Hey guys, thanks for tuning in. I'm Kathleen, registered dietitian and owner of Have Your Cake Nutrition and Wellness. And I'm here with Nicole Myers, and I will turn it over to Nicole. Let you
Hi,
introduce yourself.
I'm Nicole. I've been working with Kathleen for a couple of years now. I'm a dietitian, a diabetes educator, and intuitive eating counselor.
And we are brand spanking new to this whole recording, podcasting, whatever you want to call this. If you're tuning in like through Instagram or YouTube or listening, we're new, so bear with us as we fumble our way through this. But we wanted to come today and talk about gut health. We both work with intuitive eating. A lot of our clients are women, moms going through pregnancy, postpartum, but then we also have a large subset of people coming to us with GI. And we see a lot of questions around this idea of what it means to heal the gut with food, questions about elimination diets. And so we really wanted to speak to these issues. I know I love working with GI disorders. I don't even know how I got into this. It just kind of happened. And then I was like, oh, I really like this. This is what I like. And I think it is because it can completely impact absolutely every aspect of your life, GI issues. And it's not, a lot of people don't appreciate that, when you have issues with diarrhea, constipation, bloating, whatever it is, like whatever your problem is, that's hard to get away from. You are reminded of that at every point of the day as you're trying to do life. And that can mean you get really desperate to try things to fix it. And that can be a very slippery slope as right, Nicole, as we know, we fall down the rabbit hole there.
Yes, absolutely. Yeah, and I got into GI, I think, over the years, just because there were so many people coming with that, or maybe they weren't coming for that, but a big barrier to working together or moving forward was IBS, or okay, I can't eat these foods, or limiting what time of day. I worked with people where they won't leave their home to go to an appointment if they've already eaten. And it completely does affect their days. So over the years, hearing so much of this, I did more education around it just to be able to help people. So it's kind of found me, I think, but it is something I really like to work with, because I feel like when you're working with any GI issues, gastrointestinal issues, you really have to get to know the person first and ask all about their lifestyle, how they're managing stress, how they're sleeping, their preferences with eating. So it's almost like a little bit of a puzzle. Each person's different to kind of figure
100%.
out.
Yeah, that's a good way to put it.
Maybe they've tried X, Y, and Z before. So it's kind of interesting to kind of work on these problems together. And you also see a lot of good results pretty quickly. So it's nice to get that positive feedback from them, and seeing them being able to do more or eat more, enjoy food in shorter amounts of time and working together, which is nice for them.
I think you describing this as a puzzle is such a great word to use, because it is a puzzle. And if we think about all of the aspects that impact our gut, we often just think about food. What we eat is the sole contributor to then how we feel, and that is very false. It doesn't work that way. We have hormones, we have medications, we have stress, we have environment. There's so many different pieces that come in to impact the gut, and food is a tiny part of that. Yet I think it gets the majority of the focus. And this is probably a lot where, diet culture, this focus on, the right way to eat or the certain way to eat kind of comes in there, but if food is, it's just tiny, it's a tiny part. So, and I, in terms of types of GI issues, like you mentioned IBS, so inflammatory, irritable bowel syndrome, like definitely something that we see a lot, and that can mean constipation, diarrhea, it can mean both, bloating, all those kind of stuff. But then I'm also seeing a really large influx of SIBO, or small intestinal bacterial overgrowth, which is a newer diagnosis, I would say, coming up. It's a little controversial. And so that's been very, from my professional mind, it's been very interesting to work with, because there's been a big learning curve with that, because it is very controversial. But I've just, that impacts everybody's life so much, and can impact then what you're eating, and you feel like you can't eat any of the foods. So that can be tough. And then we have inflammatory bowel disease, gastroparesis, general reflux, all of those types of things. So we see it all, we do it all, and we try to fit the pieces of the puzzle together to figure out what exactly is happening. So I love that word. I'm going to use that now. But I think that a lot of our clients coming to us are really frustrated. There's just this huge frustration piece there, because they've tried everything. They have fallen down the rabbit hole of this idea that they can fix themselves, like quote unquote fix themselves, or heal their gut. And so they've tried all the diets. Nothing has worked at all. They're still sitting here with the same problems, or maybe it's worsened their problems. Maybe they've done food sensitivity tests and they have a long list of foods to avoid. So they're just generally confused about what to eat, or reduced to a very small number of foods that they're able to tolerate and eat. And so this is kind of like a last ditch effort of what do I do? What do I do here? They're frustrated.
It's often years, before someone comes, like at least 2 years, sometimes 10 years, and they've maybe seen doctors. Sometimes they haven't, which is shocking, and just have kind of been moving along, and they're finally like, I'm going to talk to someone about my diet. But it's just amazing how long people will kind of suffer without getting like all the support they really deserve, right?
Yep.
Yeah.
Yep. And I feel so much for our clients, because again, a lot of these people are moms. And as a mom, life is hard enough. It's hard enough just to cook a simple dinner for my family, let alone keeping in mind like, oh, well, this makes me feel this way and that makes me feel that way. And, just feeling so restricted. And it's just, that's so much stress that is just added to an already hard situation. So, well, when I talk to my clients, I spend a lot of time kind of going over the microbiome. That's kind of, I think, a hot button word now that you'll hear a lot from doctors or just general internet searches, and so the microbiome is just the makeup. Well, there's microbiomes all over your body, but we're specifically looking at your gut microbiome, and this is all the makeup of bacteria and fungus and microbes that reside in your gut, and it's incredibly diverse. And the interesting thing that I find so fascinating is that this entire world, I always think of it as like a Dr. Seuss world. Like in my mind, I'm like, oh, it's a Dr. Seuss world in your gut.
That's a good image.
Yeah. But this entire thing, it repurposes itself. It recycles itself every like 6 to 8 weeks. Your whole gut microbiome keeps changing. And so when I'm working with clients, I really stress that 6 to 8 week kind of mark, because, as we're trying different things, your body is naturally it turning over and changing. And so that's what we're going to use. We're going to use your body's natural process to help with, altering your symptoms. And, there's no perfect microbiome, which I think is also another incredibly fascinating piece of the puzzle. There isn't a perfect one. Like, it's not like, okay, everybody has to strive to this. It's unique to absolutely every person's body, which makes what we do a little more challenging. I think what doctors do a little more challenging, because quite frankly, we don't know a lot of what happens. We don't know what bacteria or fungus or microbes are ideal for somebody. We've done research and have, an understanding of, these probiotics for inflammatory bowel disease are proven to be effective. But in terms of, the average layperson, we don't know. Science is new.
Mm-hmm. Yeah, it's really limited. And it's amazing how many people will be on them for like years at a time, and they're very expensive too, so it's something
probiotics, yes, expensive.
It's going to be okay if you want to try one, and maybe we can try to tailor that to find a strain that might help for your constipation, say, but at the same time, we don't use that as like a first line. This is, and waiting for that to help, because it can also take a long time. Usually I'll say, to try it for at least a month before saying, okay, this feels any different. So it's slow. So we can't really say that it hurts most people, right? Unless you're like, have immune related issues. That's like one of the cautions, right? And using probiotics, but it's costly. So, it's costly, it's your time and money. And there's often so many other things we can do that will give you quicker results and more meaningful.
Right. And I think, when we get clients that are coming in, I've been on this probiotic for years. It's like, oh, and that when it's been that long, when it's been, years, that in itself can be harmful, because, there's now this thought that does that hedge out probiotics that your body personally needs, like, that would be optimal strains for your body. Because at the end of the day, your body makes its own probiotics, right? Like, we eat food which has prebiotics, feeds the gut, creates probiotics in a very simplistic world. So our body makes probiotics. So is the strain of probiotic that you've been taking for like 3 years, has that been hedging out something that your body has actually needed to make? And so that's another really fascinating topic of research, I think, that's out there. So
and a lot of the research that I've read, the longest they'll have people on these, are 3 or 4 months. So they say, you can take such and such strain for constipation, for example, for 4 months or 2 months or something. And we don't really know the safety past there, so it is one of those things that.
And all the longer term, I would say like 4 months, 6 months probiotic usage that I have seen has been for like a C. diff infection, that somebody has had, or an IBD, somebody who's been diagnosed with IBD. And we know specifically that this strain has good research backing it, that, it can help. But again, we're talking, 4 to 6 months, not years of taking the probiotics. But yeah, no, I get that a lot of like, well, what if people ask me, well, what about a probiotic? I'm like, no, let's start with something else. Let's start with something else first. We'll revisit this and kind of go from there. But I mean, science has changed so much, and I think it's going to continue to change a lot in the next 10 years, which will be interesting. The other term people bring up to me that I get questions on is like this term of leaky gut. And I don't know, I'm curious what your thought is, because I thinking about it, I don't know if I've been asked that as much in the past year or two. I think in the past 10 years, like in the past 10 years, it was like a really, really, really big term. But now that I'm thinking about it, I'm wondering if it's fallen off a little bit in the past like year or so. Have
Yeah,
you
maybe a
have
little
you had
bit.
people ask you?
Not as much, but I just see it everywhere, right? See,
Right.
like, I don't know, it's just referred to a lot, like it's a, epidemic that we're all experiencing or something. And I
Mhm.
think it can be um kind of thrown around a lot, especially in like the alternative medicine sort of scene as well. So yeah, so but I think it's good to address just because I'm sure people
Yep.
have heard of it and been like, well, like what can that mean? Is this
Mhm.
me? Is this why I experience my bloating or whatnot? But yeah, leaky gut it's not a medically recognized term.
Good
We
point.
refer to it, yeah, we refer to it as intestinal permeability. But so when we kind of describe it in like popular culture or whatever, it's described as, openings in the gut that are going to allow food particles through, bacteria, toxins that enter directly into your bloodstream. And so I think it's, actual intestinal permeability is a little bit less dramatic than, or doesn't, um, what we want to do is that in our intestine, we have tight junctions. So that's the space in between intestinal cells and generally, that there are, immune proteins. We're just trying to, when we try to improve the intestinal permeability, we're really talking about those tight junctions, and just keeping the intestinal cells healthy, right? Because we do want to, um, we absorb a lot through our gut and a lot comes through our gut, and we want to keep what we want in the gut to stay in the gut, and what we don't want, out of the body, out of the bloodstream. So we do see intestinal permeability, but it's something that you more see in research scenarios. There isn't like a clinical test for this. So we don't even know, when people are referring to it, that is exactly the issue. We're not there yet
Mhm.
with research.
Which I think is a huge thing because I've gotten clients who have gone to alternative doctors and they tell me I have been diagnosed with leaky gut. And it's like, oh, have you? Okay.
Yeah.
Because it's not a diagnosis.
Yeah. Yeah. Not yet. Maybe in 10 years, there might be
Right. Who
something
knows?
where, yeah, you ingest something, we take a blood test and we say, okay, it did get through or whatever, but we're not there. So I do think it's really overused.
Mhm.
And that can be harmful in itself. And I think that leads a lot of people towards what you mentioned earlier, that food sensitivity testing. There's a lot of brands, but like Everlywell is one I see pretty frequently. And this
Mhm.
is testing for an IgG reaction to foods, which is, referred to as a food sensitivity test. And that changes constantly. You could have that test done one week, it would give you one printout of maybe foods that might be problematic for you, and you do it the next month and it will look different. So it's not a good indicator. It's not evidence-based. And they're really, really expensive as well. So, but I
Mhm.
think,
They're not covered by insurance. Yeah.
yeah, those two kind of go hand in hand. I feel like,
Mhm.
when you have any inkling of leaky gut and maybe you're Googling and stuff, you're going to see a lot of this come up in your searches or with
Mhm.
advertising and things. And a lot more research is needed there. We're not there. And again, maybe in 10 or 20 years we will be, but until we are, I think a lot of the ways we're looking at this are they are too restrictive for a lot of people, and that can be problematic.
Yeah, I think like as anti-diet dietitians, right? And we really strive to, work through it into an eating lens and everything. What gets me with these diagnoses of leaky gut or is um again the research, keep going research, we need you because we just don't know. But right now, if again it's usually alternative medical providers that are throwing these terms around to clients, or Dr. Google that's throwing this around. The problem is their response to that is a restrictive elimination diet.
Mhm.
So it's not like there, perhaps there's some like validity to this idea of, yes, intestinal permeability. Yes, we need to help the health of the gut. And we'll go through the laundry list of things we can do, because there's a lot that we can do with this. There really is. But the problem with the mindset of this leaky gut diagnosis is the response is elimination diet. It is strict. It's food restriction. It's these false hope through food sensitivity tests. And so at the end of the day, it really is a very harmful place, or a term that is thrown around out there. So I think that just gets me. I've had clients come in, that have done the Everly Well food sensitivity test years ago. They did it 2 years ago, and they show me their card with 20 foods that they can't eat, and I'm like, okay, that was 2 years ago, and we're in a completely, we got to start from a blank slate. We got to, again, it's that puzzle pieces, like the puzzle pieces we have to fit together. And just thinking about food as like the only part to this is doing a disservice to people. It's just doing a huge disservice to people. So that it makes me a little angry when other healthcare providers have reinforced these messages there. And so then, as a new provider, it's kind of like, okay, we have to backtrack. We have to unlearn, in a way, what you've come in with, and then we have to start from the beginning. Yeah. So, but I think the elimination diets, the addition of supplements, all of these things that are thrown at people is, you have to remember somebody's mindset who is going through, GI issues. Like you said before, they've probably been dealing with this for years, 10 years. And they're desperate. There's a sense of desperation because GI issues influence every aspect of your life, like every single aspect of your life. So there is a desperation there to take this idea of like healing yourself into your hands. And so I think that's where elimination diets gets fueled.
Yeah. And I think a lot of people don't feel heard by the medical community. So they're like, of course you're going to keep looking. And that's going to be with less, support, unfortunately. So it's really tough. What are you finding are the most frequently used elimination diets these days?
I think that the biggest one out there nowadays is the low FODMAP diet. I think that is has hedged its way up to number one. There, in the past, I would say over the past 15 years, I would have said like gluten-free would have probably been the most popular one.
Dairy-free.
Yeah, gluten-free, dairy-free, just, kind of picking, these major food groups. And I still think that's incredibly popular. And to a degree, it depends on the type of GI problem we're talking about in terms of like which elimination diet is most popular. Because, when we get into, inflammatory bowel disease, there's, the specific carbohydrate diet, which has been gaining traction for some people. And research is really limited and inconclusive with that. It's eliminating all processed foods and grains and yada, 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 all this stuff. But then I think when we're talking general IBS, I think the low FODMAP has been, the winner recently with that. Would you agree?
I would. And I think that's another one that unfortunately you can get not the best information. And I've had some people that have come to me and they've been like, been on it for actually 2 years, 3 years, which is not the way it's meant to be used, and makes it really hard to guide someone emotionally through adding some of these foods back, because it's been so long and there's such a fear around trying different foods or varying amounts of foods in their day and things. So yeah, I would say that one's tough because there is some good research and there's some really great success with it. But I would definitely suggest undergoing that, right, with a trained dietitian that can
Mhm.
guide you through the whole process and just make sure we come through to the other end eating more
Mhm.
foods than when you started,
Right.
or more comfortable, because there is a lot of nuance to it that you miss when we're just finding this information on blogs, or the worst the worst is that I see a lot, people will come and they'll say, I've tried the FODMAP diet, or I've been on it for a while, and my GI gave me this one sheet of paper on it, and it has, do you remember the old one? It's like a red, it's like the foods to avoid in red and
Yep.
the foods to eat in green. And
Green.
that one I remember from like literally 10 years ago when I first took my
Mhm.
training. That was like one of the only handouts that was available. And we know so much more now. And it's such a,
And I still see that.
it's
I see
still
what
around. Yeah.
doctors are giving to clients. And it is still kind of like the red light, green light type
Yeah.
list.
Red light. That's what
And it's so problematic because there's definitely validity behind the low FODMAP diet. There's research, there. But at the end of the day, one, low FODMAP diet is not meant to be used for longer than 6 weeks. It's really because it can really cut out a lot of very like nutritional foods that you actually need in your body. So these short period of time is how it's supposed to be used. But two, FODMAPs it's an amount based. It's based off of like an amount of FODMAPs in certain foods. There's not a lot of foods that are completely free of FODMAPs, besides like meats and that kind of stuff. But most foods have FODMAPs in it. Even the foods on the green list, like the green light list of what they say that you can have. The problem is there's an accumulative effect with the FODMAP, with foods in the FODMAP. So somebody may, or I see this all the time, like, using this, they say, oh, well, I just eat stuff on this green list, but how they're going about doing it is actually creating a high FODMAP situation, so even they're restricting their foods, they're still getting high FODMAP amounts. And we call that stacking, like stacking your FODMAPs. So it can be problematic. And like you said, there's not a lot of education for people. I also think that doctors, I hate to like generalize here, but I'm going to generalize because I just am. I think that a lot of doctors get they don't receive nutrition education in school. They might get 2 hours, right? And so it's like, how do you get all that information in 2 hours? So they're not the experts in this, but they're in the place that they are saying, okay, well, I have nothing else to offer you. Why don't you try this low FODMAP diet? And they send people off. And that's literally the education that clients get, is that red light, green light list. There's just such poor support there. And then obviously it's not going to work and they get frustrated. But their doctors told them to do it. So they're going to keep doing it. They're going to keep restricting. So it's just such a slippery slope that you fall down. I think I would say when I'm talking with people, if I get somebody in that has not tried, certain types of diets, like let's say I have like an IBS client that comes in, I would say I very rarely say, hey, let's try this full low FODMAP diet, and boom, go from there. I like very rarely do that because there's so many other places to start that are less restrictive. However, I would say the majority of times my clients are already coming in on a low FODMAP diet. So that's kind of how I almost get forced into having this conversation of FODMAPs because they've already put themselves on the low FODMAP diet. And so, okay, how do we deal with this now? And how do we kind of bridge the gap a bit?
Yeah.
Would you agree that you see like most of your people are coming in already on the low
Yeah,
FODMAP?
on it. Yeah, on it. And usually not with great resources. So we might finish out another week with some resources that I can give that might expand on what they can eat, or give more ideas for variety, or just help with some of the boredom of it. And so we
Yeah.
might do that, but then I do try to transition them off as soon as I can, or start, testing those different FODMAP food categories just to see, what is actually true for them, and doing it systematically, and, following up in 3 weeks and talking about it more,
Yeah.
so that
Yeah.
there's more guidance and
Yeah.
support throughout. But yeah, so
It's tough.
yeah, it is really
And I
tough.
would say if you're not familiar with what the low FODMAP diet is, I think again FODMAPs, like, and how we term it, like anything diet sounds very negative, so then I think it makes FODMAPs themselves sound negative, and they're really not. They're actually a necessary part to food. And so when I see a new client and we're having this conversation, I always described FODMAPs as Lego blocks. So like, and this is like simplifies it a bit for people, but like our body can absorb like one Lego unit, right? Like one Lego block, we can like absorb that. And so FODMAPs are lots of like Lego units together, and we can't necessarily break them apart to absorb, right? And there's a reason for that. There's, again, our bodies are very smart. Like there's a reason for all this. These provide food for good bacteria, creates a very diverse microbiome. But sometimes a side effect of that can be gas production. So like if you're having bloating and you're eating foods that are producing more gas, right, that's going to cause more bloating. Or sometimes that it can pull water into our intestines. So if you're having diarrhea, if you're eating foods that cause more water to be pulled in, that can also exacerbate symptoms. So, the research behind this, the thought behind the low FODMAP diet is let's lower those foods that cause, more bloat, more gas production, more water being pulled in. Let's calm the nerve endings down of your intestines. Let's like just give it a break for a second while we do other things, obviously. And then let's challenge that. Let's reintroduce. So it's not meant to be, again, like this long-term thing.
It's like a learning diet, right? It's to come
Yeah.
away with knowing, I can do some dairy, but if I do 3 cups of dairy in a day, then that's not going to feel great.
Yeah.
And just have some information. But I think a lot of these foods that might bother people, they're hard to pinpoint when you don't have any awareness of it. So it just feels like everything's bothering me, so that's one thing I do like the FODMAP diet for, is because we can kind of maybe pick out 1 or 2 things that are maybe more bothersome, but the majority, right, most people can tolerate most of the things, right?
Most foods,
but
right,
right.
It's not like, so wheat is an example of FODMAP. However, it's very different from then, so somebody who has celiac disease, right? Like obviously you can't have gluten if you have celiac disease, because the smallest bit of gluten is gonna just set things off, right? There has to be a complete break with that. Low FODMAP is very different because there is an amount, like a threshold that is acceptable with your body. And that's where everybody differs and why we're learning, of like, well, what is the amount? What is the amount that you can fit into your intestines, AKA I call buckets, like your buckets, and when you eat more, you overflow your bucket, and that's when you have symptoms. So how can we keep the water below your bucket? So I think there's, in people's minds, they think, oh, but I can't eat any wheat or gluten or whatever they want to say. And no, that's not the case. You don't have celiac disease. There is a difference. How big is your bucket? What is that amount that you can tolerate? Like you mentioned the dairy example. Can you have some yogurt? Maybe you can have 3 cups of yogurt. What is that level in there? And even the smallest amount of food, again, helps create that diverse microbiome there. And I also think what people fall into is that fear of eating when you have GI issues. Like there is a fear component around eating. And so the pattern to the day looks like long gaps of not eating, and then you just get so hungry because obviously your body needs energy, and then you'll eat a really, really big meal. And unfortunately, that's going to overflow your bucket. You're going to have problems. And it's almost like a positive reinforcement in your mind of, well, yes, that food caused X, Y, and Z in my body, and so that it's bad. But the eating pattern itself is probably a big contributor to it. So,
yeah. Then also reminds me, like, a lot of elimination diets can kind of feed into disordered eating too. Or if someone has had a disordered eating past or eating disorder, then they definitely wouldn't want to proceed, right? That would be really, definitely contraindicated. And I think, a lot of the problems is that, like, that's probably not screened for at your GI doctors or even your primary care. Like, I've never been asked questions that poke at that at all. And the dozens of doctors I've seen in my life. So I think that can be really something to kind of consider, and definitely proceed with caution, with, tons of support with any GI issues, because GI issues and eating disorders, disordered eating really overlaps
hand in hand. Yep.
It overlaps a lot. So there's usually some component there to that. And it's something to be mindful of and aware of, for other providers, or if you have a history of that yourself, just kind of knowing it might not feel like a trigger now, but 3 days into elimination diet, that can feel really triggering and kind of can be.
And there's the newer eating disorder. I mean, newer in what, past, maybe 5 years, it's gotten ARFID, avoidant restrictive food intake disorder. And that, I think, is very predominant in GI. When you can come into GI disorders with disordered eating, and disordered eating can breed GI disorders, and that's where you get a whole overlap. But then you may have somebody that doesn't have a history of an eating disorder, develops all of these GI issues, and all of a sudden now has disordered eating patterns. And that's kind of where the ARFID diagnosis can come into play, of like that avoidant restrictive of certain types of food, because there's that fear component around it, because in their mind they have had that positive correlation to I don't know, bread and diarrhea, which completely makes them incapable of living, and so that's a big thing that is out there, and that I also don't think is supported or screened for that much.
Yeah.
So again, more pieces of the puzzle. And this is why anybody that has any kind of inkling of disordered eating disorders, these messages that they're being given about them being able to control this healing of their guts, or being told to go on an elimination diet or some type of restrictive diet, it is so harmful. It does more harm than good at the end of the day. And even though, like with the low FODMAP diet, yes, we do have research that shows it can be beneficial, there are people that is not the case for that. And we have to be very careful with how we're using this to screen for these potential problems. And that doesn't mean that we have less to offer for somebody with like a disordered eating history or history of an eating disorder. It's not like, oh, but now I can't do this thing that has research backing it up, and I can't heal my gut, quote unquote. That's not the case. Like, we have so much for you to offer for you, because remember, of all of the so many things that come into impacting your guts, and restrictive eating itself changes the motility of your gut, which can cause GI problems. And so at the end of the day, I don't want to say simply addressing, but addressing disordered eating, addressing eating disorders can help GI problems. So there's just such a big spectrum of how this is addressed.
Mhm.
I think this is why we love this this field with the GI field, because no two clients are alike, no two people are alike, and it truly is finding the right protocol for somebody, you know, or the right set of things, like, you know, tools to help them.
Yeah.
And it can take a long time to address problems.
Yeah. But maybe we can shift into like what we can do to support
Yes,
gut
yes.
health in general.
I know, now that we've talked about
And one, which is
don't do this.
which is the opposite of elimination diet, is actually a more diverse diet, helps with the
Yes.
microbiome,
Yes.
and a variety of plant foods, and kind of as many as you can get, you know, in the course of a week. And I'll often try to get people, I forget what the exact number is, I'm like blanking right now.
Oh, the number of different,
like
20,
30,
I believe it's 20, yeah, 20 to 30 different
20, 30, yeah,
types of
types of foods in a
fruits and
week.
vegetables. Yeah.
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 And, you know, like herbs can count, and garlic
Mhm.
and things. So it adds up quicker than you would think. Like 25
Yeah.
to 30 sounds like.
And it's not amount based. I think a thing I want to add in is it's not amount based, right? Because it's like, you think, oh, but I'm supposed to eat like this huge salad. It's like, no, if you like, I don't know, add, I don't know,
Sunflower seeds on the top. Like that's
yeah, great.
another,
You had
yeah,
the
that's
fiber,
another.
let's check it off. If you have like 4 raspberries with some cereal, that you, oh, look, you've just added one, you know? So
Yeah.
it's
Yeah.
completely independent of amounts.
Exactly. But the variety is huge. And that can kind of be a fun way. I think it's a positive way to like look at like what can I add, and like how can that add up throughout the day or throughout the week. And it can just be, it's, I don't know, a more interesting way to eat, you know, if you have
100%.
the time and the means and things. So yeah, I like focusing on that just because it's a positive way to look
I
at
think
it.
with GI, yeah, the what can I add versus what can I take away? Because so often, again, when people are told to do elimination diets, it's all about what to take away, and like we don't think about what to add.
Mhm. Exactly. Yeah. And then what you said before, just with the microbiome, how that changes every 6 to 8 weeks. And thinking about like, what can I add again with maybe some naturally
Mhm.
fermented foods like yogurt or sauerkraut, kimchi. And are these foods going to like drastically change your gut microbiome? Probably not, but they're going to support it. And it's, you know, a good way to get in some different nutrients as well. Um, what else can we add? Just looking at the role of stress and like what can I add to manage
Mhm.
my stress levels throughout the
Mhm.
day, and kind of like you said, going back to that mind gut connection, that can be really powerful for some people. I've actually had a couple of people, I have like 3 people right now trying gut hypnotherapy.
Mhm.
There's a new app called Nerva that kind of guides you through, they're almost like little mini meditations, or I think it takes like 20 minutes or less a day. So I'm having people try that out right now, which they're,
Oh, I'm so curious to hear what,
yeah,
if they
because
like
even
it, because
that,
that's a newer app.
yeah, and I've heard something like gut hypnotherapy can be just as effective as like the FODMAP diet. I heard that like comparison once. And again, like
So
comes
much.
back to disordered eating, like you
Mhm.
could do a lot of these things that we're talking about and get great results without never having to like set foot in a
Mhm.
near an elimination
Yeah.
diet. Because
Yeah.
some of that data
There,
is there.
the
So
mind gut, the data is really interesting with that. Like the mind gut connection is such a huge thing. And yeah, the data is out there is showing that gut hypnotherapy by itself is just as helpful as potentially a low FODMAP diet. So like you said, we maybe don't even touch food. We look into this gut hypnotherapy option. I used to work with a therapist that did gut hypnotherapy, and it was a series of, I think it was 10 appointments, around 10 appointments. And it was so helpful, and great to have that resource. Unfortunately, it's hard to find practitioners that do that, especially local. So I'm really excited that this app is out there. I haven't used it as much. I'm gonna guinea pig myself and put myself through this. So I can tell
yeah,
people like what it does. But I mean,
yeah.
it's such the mind connection is huge. And, I think that, I take time to explain to people, like, one, how big this is, but two, also to make sure that they know, um, that this doesn't mean that I think that you're creating your issues, and like your stress is creating your problems, because I think that that's unfortunately how a lot of clients think. They hear stress, they hear anxiety, and they're like, oh, what, you think I'm just like making my problems? And no, that is 100% not what we're saying. You have physical issues right in your gut, like you have GI issues, but your stress, your anxiety can directly feed into that and exacerbate those problems. You know, a lot of some doctors will use antidepressants, anti-anxiety medications to actually like prescribe them to help manage GI issues. A lot of it generally is more of like an IBS-D, like more of a diarrhea. So you have like an overactive intestinal tract, for lack of a better word, and it kind of helps calm things down. But unfortunately, what I think that it's not always greatly explained. And so when I'm seeing clients that have been told to take this, the narrative that I hear is that they don't understand why they would be taking an antipsychotic medication for their gut issues, and they almost take offense to it because of that stigma around mental health that's there. And so I think this is a big big area that needs some focus on, needs some we need to handle with like kid gloves in a way, and explain to people why this is being recommended.
Absolutely. Yeah. And then what else? I think just keeping people regular, like working on
pooping regularly.
Yeah, pooping. Yeah. Ideally every day, maybe twice a day, maybe every other day, but just something that helps you feel like you're eliminating, you're feeling complete and comfortable. That can cause a lot of like bloating and like just backup of gas and things. So, and with that, we can talk about, again, foods to add that give us some soluble fiber, things like apples, oats, and barley, beans, avocado. And then we sometimes will use psyllium, which is like Metamucil essentially, but a fiber supplement. And that can really be helpful for both constipation and diarrhea, and just helps kind of support.
My favorite has been sun fiber. Recently, I mean, depends. I think psyllium is probably more effective for some people, but it's also kind of a pain in the butt to take, to be completely frank. I had one client who they were like, no, I just mix it with water and I just shoot it back. I was like, really? That sounds terrible. But whatever, if that works for you, cool. So it's a lot harder. I think if you're doing smoothies or then it's not that bad, because you can like put it into there, but it gets thick. And it's just harder to take. So sun fiber like mixes into water, and it's just generally a lot easier to take, and a lot of people do really well with it. Again, there's that definitely a sub population that needs psyllium. They just need that more like oomph there. So, but again, that's another figuring out what works. But yeah, pooping regularly. I mean, I get clients, again, there's different ends of the spectrum. We have constipation, we have diarrhea. I get clients that are going, 10 to 12 times a day, right? Like they're pooping 10 to 12 times a day, but it's not, maybe they're not completely evacuated, or they're not, it's like not productive in a way. And then on the other end of the spectrum, I get people who haven't pooped for a week, maybe 2 weeks, and it's like, oh, we gotta get things moving. And there's more of an urgency there, because like you said, it impacts everything. There's like this trickle up effect of stuff. I can't help your bloating until we can get your GI tract moving. because your bloating could very much be fixed by just getting you pooping more. So yeah, the soluble fiber through foods, like, changing the diet up a little bit, working on water intake, because let's face it, we're all usually not that great at drinking water sometimes.
My water
here. I know I've been drinking my water. But I mean, it can be actually really hard, so sometimes it sounds like, oh, well, of course I need to drink water. It's like, well, yes, we all know that, but logistically, let's talk about your lifestyle. Are you a teacher and you're in front of students all day and you can't take a bathroom break, so you pull back on the water, or like you're a nurse and you can't have water on the floor, whatever it is. There's so many logistical reasons you may not be drinking enough water. And so like, what can we do with that? The other thing I really like to use with my constipation clients is magnesium. I think Miralax is thrown in there a lot, and definitely time and place for Miralax. That's like the go-to for doctors, but I think for longer term use, I really like magnesium a lot more. There's some preliminary studies about like longer term Miralax use impacting your gut microbiome. So again, there's no, if you need something quick, like, because again, we just got to get you going, and you've been on Miralax and you have it, let's just use that. Let's keep you going. And then let's maybe switch over to magnesium. So again, it's like that puzzle piece of what to do. And I always tell people, like, it changes constantly, because like what we are doing now, in a couple months, when things are moving, we're going to change this up again. So there's so much to do. There's so much to do to help people with their GI issues. That is not eliminating food or restricting food. That, I get really passionate about it. I'm just like, we can help, we can do this. But I think that to kind of like tie this back into intuitive eating, because I think, how we practice is based upon intuitive eating, meaning we're really honoring like the mind body connection with how we're eating. And so when it comes to GI, what that means is realizing that there are a lot of things that we can do, and we don't have to eliminate foods in order to fix things or help with things. I would say that for me, at least, the number one piece that I work on with clients is consistent meals, consistent balanced meals, because again, a lot of times they've gotten into like the restrictive binge pattern because of their GI issues, and that just makes the issues worse. And so the consistent meals is a big step on what I might work on initially with them. And then also feeds into this idea of, the FODMAPs, because, sure, foods that create more gas, maybe we want to decrease, but if you're eating all of them in like one meal, you're of course going to have problems, versus if we're simply, if we're not even talking about like the types of food you're eating, we're simply spreading out the food eating amounts, that goes a really long way. And I would say like 90% of people do fine with just that. Like we don't even have to go into taking things out necessarily.
Yeah.
Would you agree? What would you say your biggest thing is when you're seeing a person?
I think one is being open-minded about, maybe today dairy doesn't sit well with me, but thinking about like trying that food again in the future, just because our gut does change over. And I think it just kind of ties into, listening to our body, right, with intuitive eating and those signals that we're getting and that feedback that we're getting. And but also at the same time having some flexibility and just being open-minded around, I might be able to eat a different way in several months or a year or something, and just being open to considering other things. And then just when it comes to intuitive eating and kind of the later stages of intuitive eating, or steps, if you will, is honoring your health. And really that's kind of looking at how, how are we supporting our health through nutrition? And if there are foods that make me truly feel terrible, will I probably eat less of them? That would be honoring your health.
Right.
That would be intuitive eating, because you're getting some very clear feedback from your body and you're listening to that. And that is exactly what we're trying to get at with intuitive eating, right? So might we eat that food in a different manner, or less often, or in a different portion or whatnot, or a different combination of foods? Sure, right? So I think, again, just listening to that feedback from the body and trying to tune more into that plays a big role with gut health.
I think it can take some time, if somebody's not familiar with intuitive eating, there's 10 steps. And so what you're talking about is like the last step, honoring your health. And so, depending upon, your history with food, or, all that stuff, it can take some time to actually get to that place. So, so other places to walk through, for a lot of people is, figuring out like what hunger and fullness is, because those are earlier principles there. And so I think that until you can truly sit and understand what hunger and fullness is, like you can't necessarily honor your health. And so there is a tendency when somebody's having a GI issue or any kind of like health thing, right? Whether it's like high blood pressure, diabetes, like whatever, there's this tendency to jump to the last step, this like honoring your health. And so kind of creating it into like a restrictive place, right? And so I think what we do is like, as we're working with people, screening them like, okay, let's come back a little bit, we still have to talk about these other pieces, and specifically for GI. Again, I think that there's just a huge tendency to get into that restrictive binge cycle because of that fear around food. And so like, what is hunger and what is fullness? Because your body's probably completely dissociated from those places. Yeah. So, intuitive eating is just such it's like so powerful in terms of GI problems for people. And I think that, again, clients want that like quick fix, just tell me what to eat, tell me what not to eat. It's like, no, there's all of these pieces coming into play. It's like that puzzle, and we have to address all that. And intuitive eating is such a powerful tool to address that. So, but I would, to kind of like give a few takeaways for people, I would definitely recommend not doing anything without the guidance of like a trained dietitian. Don't eliminate foods. Don't start out on strict diets without actually talking with somebody. One, for GI specifics, I see this all the time. They've gone gluten-free, they've gone, whatever. And we want to work with a GI physician to like rule out issues. So like if you put yourself on a gluten-free diet, we have a much harder time checking for celiac disease, right? To see if like, well, is that actually something going on? So it can just medically do more harm, or like make figuring out what the problem is a lot more challenging. So definitely don't just put yourself on strict diets, and really working with this trained GI dietitian, because all of those foods like FODMAPs and whatever else, we're trained in that. That's like that our brain is working in figuring in like, recognizing what foods are causing more gas, or, what foods can pull more water in. And so we are going to look at your, day-to-day intake. Let's say we look at, a 3-day intake, and we're specifically pinpointing that in our brains, like, okay, what foods, like, do you have higher tendencies to eat these types of foods versus that? And so we might just simply shift things very gently, and not even have to go into this whole conversation of FODMAPs.
Yeah, filter out all the stuff that
we
you
can
know. That's
exactly,
our job.
exactly.
You don't need that burden.
We filter it all out. Yes. So it's like we're thinking about all this. Our brain is going, but we don't necessarily have to have that full, you know, try this elimination diet conversation. We can do a very gentle approach there. So I think that's a huge piece, is like seek help, you know, reach out.
Yeah.
Can you think of any? I feel like there's another takeaway that I wanted to say, but I can't think of it at the moment.
Yeah, I can't think of anything. I mean, one good thing to mention might be that we do free 15-minute discovery calls. So if you're someone who's on the fence, or maybe you've worked with someone before and it wasn't what you thought it would be, and you want to just touch base and see if we'd be a good fit, feel free to be in touch, and we can kind of get an ear for what you're coming in for, and give you some, you know, quick tips, and make a suggestion if, you know, if we would be a fit. So
right. We can give you an idea of like how we could approach this. Because there are a lot of pieces floating around. But you know, if that's you can go to our website, haveyourcake.com, and you know, sign up for a free discovery call there. And yeah, just know that you're not alone. You know, there is hope. There really is hope. You know, we've seen people dealing with this for years and years and years and years and years before they've come to us. And I think that's in a way what makes our job so fulfilling, or why I like it. You know, I really enjoy working with my clients, because we can make such tangible life changes after them having not a lot of hope for a long time.
Yeah.
So, yeah. Well, this was fun. I feel like we could both probably ramble on for, you know, much longer.
Probably too long. But
too long.
Yeah.
We're GI nerds
to start talking about this. I'm sure we'll have more conversations in the future.
Yes. I think we could dive into intuitive more with this, and you know, so yeah, more to come. But yeah, okay, that was it. Okay, I'm gonna sign off.